You still have my voice. Okay, great. Oh, Akila, I think we're going to be fine on time. I usually speak fast. I'll actually try to speak slower, but I do have a hard cutoff at 5. If it goes that far, I just won't be able to finish the question.
Okay, sounds good. Yeah, that's totally fine.
Thanks for adjusting to my schedule too.
No, thank you so much for doing this. Like, it's just really great to have you on here with us today.
Oh, thank you. You guys are doing something great.
Thank you so much. Yep. So we're just live right now. We're just gonna wait for a couple more people to join, and then we can begin.
Great. So what state are you in?
Sorry?
What state are you in?
Oh, I'm in Michigan.
Oh, yeah, I saw that. Great, great. Are you at University of Michigan?
I'm at Michigan State University.
Oh, wonderful. Great.
Yeah, we're applying to medical school right now, so
nerve-wracking.
That works out.
Yeah, I hope so too. When do you find out?
I'll find out by the end of the year. So we're just working on our primaries right now. But yeah.
Wonderful.
All right, so we can go ahead and begin. Welcome everyone to our shadowing session today with Dr. Marjon, who is a dermatologist. Thank you so much for being with us here today.
Thank you for having me, Akila.
Yep.
All right. So we can get into it. So today on My Medical Message, we're going to be talking about what does it mean to be a board certified dermatologist in America. I'm currently practicing in Newport Beach, California, and really excited to give this talk. All right, let's get into it. Okay, so the first thing is, what is dermatology? Dermatology is the study of skin, hair, and nails. A dermatologist is a person that has gone through training to be an expert in these fields. And the skin, as you know, is the largest organ system. It is the biggest organ that also protects us from environmental factors. To become a dermatologist, you'll have to get your medical doctor degree or be a doctor of osteopathic medicine. Dermatologists make up 1% of the physician workforce. We do have a competitive salary, but we are always busy because we're always in demand. So our clinics fill up really quickly. Usually if you open a practice, you're busy and booked within the first year of opening. So I guess when I press the next button, there's a second or two of delay, which is fine, as long as it goes forward. Okay. So there is a lot of schooling, as you know, to become a physician. After high school, you complete your undergraduate school, which is on average 4 years to get your bachelor's of science or arts. Then you go to medical school, which can be the traditional medical school or osteopathic medicine. Typically, those who want to apply to dermatology take an entire year off during medical school between third and fourth year to do a dedicated research year where they work under a dermatologist who's involved heavily in research, and they'll do research projects for a year. You can have a stipend, or this can be done completely voluntary. After that, you go into internship, which is 1 year of residency in a field that is not dermatology. It has to be a general field. Most people complete this in internal medicine. Some people do a transitional year, which is similar to just doing a month of elective per year. And then other people will do a year of pediatrics or a year of general surgery, like I did. After that, you go into dermatology residency, which is 3 years. And then from there, you can complete a fellowship where you have an additional year of training in a subspecialty. And this does not include if you were to get a master's degree at any point, a postdoc, or complete another research fellowship in residency. That can add on years as well. After dermatology residency, you're going to take your board exams and you will be a board certified dermatologist. You can get dual certification if you did a 1 year fellowship after residency. Most common fellowships are doing an extra year in pediatric dermatology or in dermatopathology, which is the study of the skin under the microscope. So these individuals spend a year looking at slides like the ones shown and looking at skin and cells under the microscope. They will be the ones reading all of the skin biopsies that dermatologists perform. Next, there is a certification for a Mohs surgeon. A Mohs surgeon is a dermatologist who's done a year of extra training in removing skin cancers, looking at skin cancers under the microscope, and they will also learn facial reconstructive surgery during that year. Starting this year, there will be an official board examination for that specialty. Now, there are other fellowships you can do for a year that don't have an exam, so you can't say you're board certified, but you can say you're fellowship trained. This will be a cosmetics and laser fellowship, also called procedural dermatology. You can do a complex medical dermatology fellowship. This would be like inpatient dermatology, so very concerning rashes that people are admitted into the hospital for. You can do a fellowship in dermato-oncology, which is, it's not that common, but it's the study of chemotherapy and things related to dermatology, like advanced skin cancers. And then you can also do a fellowship in dermatology research. Mostly that's a lot of clinical trial work. I did that as well. And I did a pediatric dermatology fellowship. I did a lot, but you don't have to do all of that. You could do everything straight, like 4 years of residency, internship, 3 years of dermatology residency, and then be done and be a board certified dermatologist. Now, in addition to these possible fellowships, you can just subspecialize or have a niche. There are dermatologists who have clinics that mostly focus on allergy and contact dermatology, which is when people have allergies to things that come into contact with their skin. You can work at an academic center and be the melanoma expert, where everyone in the city sends you people with advanced cases of melanoma. You could be a hair transplant surgeon, not even see any rashes anymore. You can be someone, this is probably more of a niche, but you could be someone that has also done a psychiatry residency or training and treat patients with psychocutaneous disorders, people who think that they have bugs under the skin, or people that have rashes where there's no cause for it. So they may need some cognitive behavioral therapy to sort of resolve their issues. That's not very common, but it happens. And then you can also just have niches. or you're a dermatologist and you love to specialize in nail surgery, or you want to specialize in skin of color, vein surgeries and procedures. You can be someone who's trained in tumescent liposuction, which is liposuction in an outpatient or office setting. And now we have a lot of dermatologists doing teledermatology or telemedicine cases as well. So as a dermatologist, for the most part, unless you're an inpatient dermatologist, your clinic will be outpatient. It will be 100% or 90% outpatient, where you're just working out of a clinic. Schedules are really easy, Monday through Friday, 9 to 5. In fact, most dermatologists, full-time is considered 32 to 36 hours. So some dermatologists will just squeeze those hours into a Monday to Thursday schedule. So it's really nice. You get holidays off. Sometimes you share a call with different people in the office if you have a large practice or your own practice. And some dermatologists don't take any call, and then those affiliated with hospitals will take call seldomly. Most dermatologists do a mix of medical dermatology, cosmetic dermatology, and simple excisions. And then depending on your practice, you could be, if you're a dermatopathologist, reading biopsy slides, doing complex dermatology, or if you're a Mohs surgeon, you're going to be doing more heavy surgeries. The most common diagnoses that we treat, and I'm sure you are accustomed to most of these, is acne, eczema, skin cancer, psoriasis, which is when your skin is just rapidly growing faster than your body is able to sort of shed the skin. You can have a benign skin growth. This is the most common thing that's diagnosed in people above 50. It's called seborrheic keratosis, where people get lesions that they think looks like moles, but they're not entirely moles. Some people call them liver spots, sunspots, things like that. You're going to get a lot of cosmetic inquiries and requests for procedures, a lot of cyst removals. We treat a lot of hair loss, and then the common rashes like poison ivy or drug rash. The most urgent diagnoses that we treat, most worrisome, is Stevens-Johnson syndrome or toxic epidermal necrolysis, which is when someone's entire skin is breaking out and it's going to shed off of them if they don't get urgent care. This is typically due to having a medication that you have a severe allergy to. Some people will get this if they take like Bactrim, which is an antibiotic, but most people don't have any reaction. So that's the photo of the child shown. So all of those marks will like turn into a blister. And if you have that much of your skin affected in a rash, or it starts to blister or peel off, then you're losing your immune system and you're going to have too much water loss quickly. So this has actually a high mortality rate, where in elderly or in older people it can be as high as 30%. So this is emergent, has to be taken care of immediately. Other things that we deal with that are very worrisome, or if somebody shows up with a skin lesion that I know is a metastasis, which means they have a internal cancer somewhere that they're unaware of, and this is just one manifestation of it. There's a condition called erythroderma, which is similar to what you're seeing in the photo, where someone has a rash from head to toe, but this rash could have been due to anything. It could be eczema that was uncontrolled, psoriasis that was uncontrolled, a drug rash. The point is they're red from head to toe, and they can also have a lot of water loss, so it has to be treated urgently. Other things that I've seen are vascular malformations or birthmarks that are large ones that are affecting the head and neck in children. If a child has like a hemangioma on the neck that's growing, as it's growing, it could impede the airway. Epidermolysis bullosa, which is a condition in children where they have blistering, a lot of blisters, and that can lead to a lot of scarring and problems in the future. They can even get scarring in their throat. Hidradenitis is something that is not urgent, but it can be very painful when patients get large cysts and draining sinuses in their armpits and different folds of their body. And then, of course, there's shingles or herpes zoster, where someone can come in and be in a lot of pain because of this herpetic outbreak. And if it involves the face and eyes, that could be pretty dangerous, because if it involves the eyes and it goes untreated, they can have permanent damage to the eyes. Now, those are worst case scenarios. If you're not doing inpatient medicine, these are going to walk into your clinic every so often. Most common out-of-pocket procedures that patients do is they request Botox, fillers, and lasers. These are all pretty much that I'm listing cosmetic because insurance will pay for things that aren't cosmetic. People will request a mole to be removed that is a healthy mole just because they don't like the size or location. They will ask that their benign growths that you get in adulthood, those seborrheic keratoses to get removed, and they'll ask for skin tags in the armpits or neck to get removed. Okay, so next I have cases, but let me see what questions we have. Oh, we have a lot. Okay, let's see. Okay. All right, so the questions are all over the place. So what I'll do is I'll answer them at the end then. Okay. All right, so next we have a case. Now, when I was looking through my photos, I'm a procedural dermatologist. I'm very hands-on. I am sent a lot of cases for excision and surgery and in locations that people aren't comfortable with, like the nails or nail matrix. And most of my photos today are just going to be all procedural. I think everyone has an idea that dermatologists do Botox or treat acne. So these are some cases you would maybe think of. So I have this gentleman that came in with a year history of having this like verrucous, warty growth under the nail. Show you in the next photo. He had this for over a year. So I told him, okay, this is a pretty simple excision, except that the setup for nail surgery is a little more entailed than a regular biopsy. But essentially, you just numb the area and you remove everything that you see. And I told him that this could be a benign growth, this could be a wart, and rarely it could be a skin cancer. If it is a skin cancer, the ones that grow under the nail could be two things. It could either be melanoma, which you would see with dark pigment, or when you get this warty appearance, it could be what's called a squamous cell, which is the most common type of skin cancer that people get. And if it was the latter, those are very slow growing. So he had this for over a year. I actually just saw him yesterday. His biopsy came back and it was positive for skin cancer, but it was a very, under this verruca or this wart, the skin cancer is actually quite thin. So he's going to have what's called Mohs surgery to remove the remainder of it. And we're very lucky to have, offered removal and was able to do it for him, or else this probably would have gone undiagnosed for many years and people would have treated it as a wart. So that's his diagnosis. It came back as squamous cell carcinoma in situ, and situ means it just affected the epidermis, not the dermis, and this would require Mohs surgery to make sure all of his margins are clear. So what is Mohs surgery? As I was saying, it's a skin-preserving skin cancer surgery, and I'm getting a pop-up. Okay. Most surgeons do an additional year of fellowship to learn this technique, although you can also test into it as well. So you have a lesion on someone's, here they have it on the forehead where you suspect it could be skin cancer. You do a biopsy, it's positive for skin cancer. Then the patient goes to a Mohs surgeon where if you look at number one, they remove a thin layer of what they see with the naked eye. While the patient sits with a Band-Aid on their forehead, the Mohs surgeon will look at the specimen under the microscope and make sure all the margins are clear. In this case, it was not clear. You can see there's little cells still reaching the base. So then in number two, he takes another layer, looks under the microscope, sees that he still didn't get it all, takes a third layer. Now each layer, he's not taking the whole thing out. He's just taking that focus, that one area. This is a very successful skin preserving surgery. It has a success rate of over 99% of getting the skin cancer out while preserving as much skin as possible. And rate of recurrence is usually less than 1%. All right. So in case two, I had this girl come in with a lesion on her back that she said she's had since childhood. Now, if I were to look at this spot by itself, I would be very scared this is melanoma. This is large. has an odd shape to it, multiple colors. I'm seeing purple, I'm seeing brown, maybe even a little black. Then I said, did you have a procedure on this? She goes, yeah, someone did a biopsy where they took the top of it off. And I said, okay, that explains why it is so misshapen and has multiple colors. We're looking in the middle of a mole now. And congenital nevi, or moles that people are born with, are usually larger than a normal size mole. She really wanted this removed. She has short hair. She feels that, well, she says that she was getting bullied for this, so she wanted to get removed. So that's the lesion up close. And what we do when we remove it is I marked the entire lesion. And then to close a circle, you usually have to turn the circle into an ellipse, like an eyeball or a football shape. So we did that. And then you pinch the top and bottom together when you're suturing it closed. And she was very happy with the outcome. And when the sutures came out, it was just a thin white line of a scar when it was all healed. She was very happy. The third case, we have somebody come in and state that he's had this cyst in front of the right ear for years, and he really would like to get rid of it. At first, you can't see much, but once I started feeling around, I could feel that that entire area had a cyst under it. We just explained to the patient that you can't really remove anything on the skin without having a scar. He was okay with that. He wanted it removed. So we went ahead and did that for him, and the scar is barely noticeable, and this was only 2 weeks out, or 3 weeks out. So if he healed way better than most people, so likely in 6 months that redness will even fade and he won't be able to find the scar. Some people do heal really, really well, which is great. So why shouldn't you become a dermatologist? Well, if you think it's going to be all Botox and cosmetics all day, then I don't think you should, even if you have a practice that's entirely cosmetic. First of all, that's very rare. Most dermatologists have a cosmetic day or two in their practice, but most of their practice is medical dermatology. If you are in it for the money, there are way easier ways to make money in this world, especially in this day and age, just go into investing. If you're doing it for prestige, you're going to be working long hours. Even though a dermatologist has an easier life than maybe a general surgeon or emergency physician, you're still a physician. You're still going to get flooded with emails. You're always busy. Patients can call you at any time because you think it's easy. If you're already in medical school, yeah, this is one of the easier specialties, but it's definitely not easy. You saw how many years it takes to get here, and it's really competitive to get into. Not only is it competitive to get into medical school, but then you have to get into the internship and the dermatology residency, and every year it just gets harder and harder. And of course, if you don't love it, you have to be comfortable with skin, you have to be comfortable with different smells, you have to be comfortable with, having a cosmetic patient come to you for something very small that maybe someone else wouldn't even notice, and then you go into a different room and someone has a rash all throughout their body, and you're dealing with like a very serious patient, and you're dealing with someone that just want something very minute taken care of. There really is a large spectrum in this specialty. And if I had any advice for prospective students, I would tell them try to nail your exams, because that, unfortunately, is the one thing that programs are still looking at when selecting applicants. I know dermatologists are not only 1% of the specialty, but they're usually in the top 1 or 5% of their medical school class as well. If you're not a good test taker, read a memory book. I was not a good test taker. Nobody told me how to take tests. I did that on tests for a long time. And then one day I decided I was going to study how to study. And I read the first memory book I found on Audible, or I listened to it. And it changed my life. You want to prepare and plan. As you know, there's always like a timeline with school applications. And if you do things last minute, it's just not going to be as good. You want to form habits. You don't want studying to be difficult for you. You want to have that habit instilled. And if you have a schedule or a routine, it makes things a lot easier. There's books on habits too that you could read. You want to exercise or meditate and take self-care. That's for anybody that wants to go into medical school or anyone in general. You want to find a mentor. preferably a dermatologist or somebody in your specialty, you want to ask lots of questions, have an inquisitive mind, and accept that you don't know. You will never have the answers. You'll learn, you'll grow, but there will be always things that you can't answer, and you'll be studying essentially for the rest of your life to some extent. And all right, sometimes the computer freezes. Okay, so that's my contact. Right now I'm on Instagram and TikTok, so if you would like to add me or if you have questions, feel free to message me on those platforms, and I'm happy to chat with you guys. Okay, now I'm going to go into the questions. Okay, I think I'm at the first one. What's the best solution to dandruff and chapped lips, and how has COVID affected the workplace? Okay, so for dandruff, any advice that I'm going to give now in regards to treatment is really going to be over the counter. I'm not comfortable at this point without seeing you and evaluating you to give recommendations on prescription medications. I'll tell you that anti-dandruff shampoos do work, but you have to leave them in for 10 to 15 minutes, like Head and Shoulders, Selsun Blue. So I tell my patients right when you get in the shower, wet your hair, get the shampoo into those roots, and then shower, shave, do whatever you normally do, and rinse your hair at the end. You can do that 3 times a week. You don't have to do it every day, and it'll make a significant difference. Chapped lips, if chapstick's not doing it for you, I actually recommend that people put Vaseline, Aquaphor, or like a thick chapstick that squeezes out of a tube like Carmax, as opposed to the ones that you get at the gas station. And you should do it morning, night, and after each meal for the best effect. COVID affected my workplace. Yeah, I mean, everybody has to wear masks and sign that they're not sick and answer a questionnaire. I don't own the practice that I'm at currently, so I don't make the rules or set the guidelines, but it's definitely changed everything. And to be honest, COVID affected me a lot because I was working on the East Coast, and because of COVID, I decided to come home and be near family, and now it's the best decision of my life. I'm in Newport Beach, California, so I won't be heading back. Yeah, and it's always good to be in your hometown too. What attracted you towards the field? I grew up in Orange County, and I'm not sure if that had any influence on it, but I was obsessed with skincare ever since I was little. And I was also really into science, and I remember my first lecture learning that the skin was the largest organ and that it had 2 layers. I thought that was so fascinating. I can't tell you why. It just, for some reason, triggered my mind, and I was so excited to learn more. I never really thought I would be a dermatologist. From there, I decided I wanted to go into medical school, but once I was in medical school, I said, oh my goodness, this is my opportunity. I have to be a dermatologist. How often do you deal with medical emergencies, and what kind of other doctors do dermatologists work with often? How often? A real emergency, like someone passing out or having a very concerning skin condition, once a month. But something urgent or worrisome, once a week. I work in a group practice right now, so I had a patient come in last week who had Mohs surgery by a colleague weeks ago. And for whatever reason, he was bleeding out of his Mohs surgery site, and it didn't have anything to do with the surgery. So I think the patient hit his head to something, and it just caused bleeding. And he had to come in, and I had to sort of help stop that. But something like that happens once a week. Okay, so dermatologists work closely with oncologists. So anybody that we believe has a skin cancer that may have already reached the lymph nodes or metastasized, we send them straight to oncology. We work closely with family medicine doctors, of course. That's who most of our referrals come from. Cosmetic physicians, plastic surgeons, anybody that's asking for a facelift, that's outside the realm of dermatology for the most part. So we're going to refer to our plastic surgery colleagues. ENT, people will come with complaints of growths in the mouth, tongue, oral cavity. For the most part, we can do those, but if it's reaching the back of the throat or we think that the case will require surgery, like in an operating room, we'll send to our ENT colleagues. What are some common procedures of dermatologists? I think we went over a lot. In a nutshell, dermatologists are going to be doing excisions of cysts, lipomas, and skin cancers. I know you guys have seen lots of that on Dr. Pimple Popper. But I think people don't know that we can do a lot of nail surgeries or fingertip surgeries. About 10% of dermatologists are comfortable doing that, including myself. We do a lot of cosmetics. We do liposuction. We can do minimal face and neck lifts if we've been trained in it. Essentially for cosmetics, anything you're truly trained in, you should be able to practice as long as you've been trained in the worst case scenarios. And then, of course, there are dermatologists who do vein surgery or vascular procedures. And then there are dermatologists who do hair transplant surgery as well. What are the responsibilities of dermatologists in the cosmetic field, especially those approving, testing commercial products as stated in many of our cosmetic products? I think you mean commercials. Okay, I get the question. It's interesting. Okay, so many cosmetic procedures and Botox, companies don't get most of their money from us, meaning med spas are one of the largest buyers of cosmetic fillers, but yet if a company that is making a filler wants to do a study on it, they're not going to go to any physician or provider. They want a board certified dermatologist in their study. So we are the ones that are reviewing the data. We are the ones that are doing the clinical trial. But then once we approve it, companies just send it out to all specialties. There may be a few plastic surgeons involved as well, but most of Botox and fillers, these are being studied at the level of the skin and different layers of the skin. So it's dermatologists who are doing the studies. When they say dermatologist tested or approved a recommendation, I, at this point, do not know what that means. I don't know if it's a board certified dermatologist. I don't know if it was dermatologists giving their opinion or they did a study. That I'm not sure of in regards to commercials. What does an average day in the field look like? I think we went over that. It's a mix of, you're going to have mostly medical, some cosmetics, some excisions. That's for most physicians. Of course, there are some physicians that will have like a whole day of medical, a whole day of surgery, a whole day of cosmetics. They like to spread it out. And then there's some people that like to pepper the procedures into their daily routine to switch it up. What is one of the most difficult cases you've had so far? Okay, the things that upset me may not be the most difficult. I remember being in the hospital, being consulted as a dermatology resident to go see a patient for a rash. I walked in there, I saw these red nodules, these bumps on her stomach, and I immediately knew that they were metastases, that she had some internal cancer that has gone undiagnosed. And that was tough. And every time that I evaluate someone and they have something very serious like that, which has happened less than 10 times since I've been in the field, it's very upsetting. I don't show emotion in front of the patients, other than concern and that I feel for them, but I do go home and personally, I do feel sad. I don't know if that makes me an empath, but I think I am one. I definitely do sympathize for patients. So mentally, that's probably the most difficult. Procedure-wise, I had a patient, after I was done with his surgery and everything, he said, I don't feel very well. And I said, don't get up if you don't feel well. Even though we were done, it was a very minor excision on the chest where I removed the skin cancer. I said, let's put your leg up. Let's put your head back. Don't worry. He's like, yeah, I just don't feel very well. I said, okay. And then I checked in on him in a minute, and his eyes were open, but he was not present. I was like, hello, are you there? And I had to like shake him, do a sternal rub. They had to call Code Blue. And then by the time the Code Blue team showed up, he was like alert and fine. And I asked him what happened, and he goes, oh, I didn't tell you. Sometimes I'm afraid of needles. And I said, what? And he goes, sometimes I'm afraid of needles, and I'll just like pass out or zone out or something will happen. And apparently this has happened all the time. I've never seen anyone just be awake. I've also never seen anyone tell me that after the surgery was done. So that terrified me because I didn't know what happened. And that's highly unusual. What is more likely is that you're just going to do a numbing injection and somebody will faint or pass out, but they should already be on the table and they come to within 2 seconds. That's more common, and that is mostly men. Do you do any invasive procedures in practice? I have done them, and I have been trained in certain procedures. At the current practice that I am at, no. They don't have lasers here. We don't do vein surgery. We don't have any like hair transplant or liposuction devices, which, by the way, most practices don't have. That's very normal. People who have that in their practices, usually that's what they got a hair transplant like machine or the tool so that they could do mostly that. So I don't currently do it, but anything that I do with my hands, I'm a fan of. So any devices we'd get, I'd probably be the first one to use it. Do you need to do research in order to successfully match a dermatology? No. You should do a few research papers, but if you score amazing on your exams, you'll get in. Dermatology has actually a really high acceptance rate, even though it's really hard to get in, because schools do such a good job, especially the counselors, of telling students with lower grades not to apply. I don't think they should not apply. I think anyone who wants to be in the field should apply, but counselors will tell a lot of kids, don't apply to dermatology, you won't get in, you don't have high enough scores. So then only the best is applying, or the people with, the highest scores, and then it looks like we have a high acceptance rate where we don't. Do you have to do research? No. It is valued highly, though. It's encouraged that you do something. As a dermatologist, do you perform any surgical procedures? What are lesions and why are they excised? So lots of procedures. We went over that. Lesion is a general term, just like when somebody says rash doesn't dictate if it's eczema, if it's a drug rash, right? It's a general catch-all term. A lesion is a general catch-up term for a spot on the skin, or a spot, or a, you could have a lesion internally too. Oh, he has a lesion on the kidney. There's something there and we don't know what it is. Lesion is a non-specific term for something that is involved in medicine. Lesions are not excised. They're only removed if it is concerning, like skin cancer, or it is bothersome to the patient, like a cyst or lipoma that's actually painful. That's why we remove things. It is not advisable to remove anything on the skin if there is no reason to and it's not bothering you. All right, I'm going to keep going with these questions. What are some characteristics or strengths that a dermatologist needs to have? Oh, man. Okay, so you're going to have to be okay with sitting and studying. But I don't think that's just dermatology. I feel like that's all medical students. You just will have a much harder road if you don't. If you want to be specific to a dermatologist, you have to be okay with seeing anything on the skin, even if it's unsightly, even if it has a foul odor, even if it's something weird or warty growing out of a nail or an eyelid or out of the scalp. You have to be okay with it. You can never use the word icky or gross or anything like that. I mean, in my opinion, nothing that grows on the skin is icky or gross. Those aren't even words that should be in your vocabulary. But if you are someone that can't handle it, then it's probably not the field for you. There are other fields that have like a more simpler lifestyle as well as a dermatologist, like an ophthalmologist or a radiologist. So there's other specialties. Since the skin is one of the major organs attributed to appearance, which can sometimes lead to psychological problems in individuals, how do you deal with this? Okay. I will never, ever, ever push patients to do any cosmetic work. I refuse it, and I don't even want to do it if they're hemming and hawing. I'm not really a fan of, doctor, you tell me what's wrong with my face. No, that's not how it works. I am the cosmetic and procedural dermatologist of this practice. So I see all of the cosmetic patients, but if they're not excited to get something done, I don't push it to them. I tell them to think about it more. I'll tell them the pros and cons, because everything you do, including Botox and fillers, has possible side effects. Could you imagine if you were on the fence about getting something done, and then after you do it, you were just one of the unlucky people to get a side effect? And then you thought, I didn't even want to do this. Now I have to deal with the side effect of it not looking the way I wanted, or I don't know, having bruising afterwards. So I will definitely encourage patients that they don't need Botox and fillers if they don't really want it. I also tell people that they're beautiful all the time. People think that a lot of moles on their face or weird, I won't say weird, moles on their face or new growths are bad. Oh, I have, a seborrheic keratosis, which we talked about as a benign growth in adulthood. It's so ugly. Can you get it off? I go, it's not ugly, but if it makes you unhappy, I can definitely remove it for you. You'd be surprised. Once I explain to people what things are, 50% of the time that somebody comes in with a cosmetic complaint will be okay not doing it once they understand what it is. What's your most interesting case, or in your opinion? In pediatric dermatology fellowship, I had a case where a patient had a diagnosis that he had a condition that didn't have a name. And I presented him at the conference for pediatric dermatology. I think it was in Washington, D.C. at the time. The Society for Pediatric Dermatology at their annual meeting. And he didn't have a name. And there was a few people in the world with similar symptoms. And there was a paper that was published. And in the paper, they still did not give this diagnosis a name. They had just written all of the symptoms in the diagnosis, poikiloderma, this, telangiectasia, and all these other things. And I took all of the symptoms and I created an acronym, POIKTMP, POIKTMP, and I presented it, and that's what I called it. And somebody came up after me and was like, you just named the diagnosis. I go, what? Like, you just gave the first lecture on this topic to a big group. From now, this is what the diagnosis is going to be called. So I thought, that's interesting. I didn't look into it to see if, there's been other publications on it and if that's what people called it. But unless it gets renamed after another doctor, that's probably what it's going to be called. I wasn't the first to discover it, so I wasn't going to name it after myself. Okay. What's the most common dermatologic issues you come across? Acne, eczema, and skin cancer, or itch on the skin in people over 50, and seborrheic keratoses in people over 50. What specific area of dermatology did you go into? I'm a procedural dermatologist. I do cosmetics, excisions, nail surgery, anything that other dermatologists aren't comfortable with, or they're just someone who is mostly reading biopsies or doing medical dermatology, they'll send to me. How has COVID impacted your procedures? Well, we have to have people during procedures keep on their mask unless I'm operating around the mouth, in which case we have to have them gargle mouthwash for 30 seconds, things like that. And then procedures dipped down for a while we were at home and we were just doing teledermatology, and then procedures all got pushed back. And then we are now back at baseline because everyone's trying to come back now and catch up on their surgeries. Are marks on the skin, such as blackheads, scar, acne, a sign of something unusual? No. Every time you have something on your skin, acne, rash, trauma, scar, doesn't matter. It will leave behind a red or brown spot there. Your skin has pigment cells everywhere, and when there's any trauma to those pigment cells, they overproduce pigment. Too much trauma, they'll even underproduce, and you'll get a white spot. That is completely normal. That darkening of the skin lasts for a few months and goes away. I just tell people to ignore it, keep it out of the sun, and don't pick at their dark spots because it will go away. If you've had a dark spot for a really long time because you kept getting the same insult or injury to the same area, then sometimes it can be permanent. But otherwise, don't chase after it and treat it. What is one of the technological advances that have benefited dermatologists? All right, I can show you this. This guy. This is a dermatoscope. It has a light and it's a microscope. It's a study of dermoscopy, which is looking at moles and lesions under the microscope. It's being used for a few decades, but it was taught in all residencies in the 90s, and now most dermatologists use it. I use it when I do my skin checks. Any moles that look a little dark from far away or suspicious, I'll zoom in and go, oh, it's fine, it's fine, it's fine. And now I can look at moles, some of them in a split second, and just see a few benign features or malignant features and be able to diagnose one way or another. Yeah, it's a lifesaver. If you're not trained in it, what will end up happening is you'll over biopsy benign things, and things that you could have diagnosed earlier as skin cancer, you won't notice it until they got bigger. So it only benefits your patient to use it, but you don't have to use it. There's a lot of dermatologists that can see things with the naked eye. How are skin allergies necessarily distinguished between an allergy, cancer, just a reaction, autoimmune rashes? So dermatologists can look at a rash and be able to tell if, oh, this is allergic. There are certain things that we study throughout our residencies that when we look at a rash, you go, that's eczema, that's an allergy. It has to do with locations of the body. It has to do with the brightness, how long it's been present. I won't go into the features of each diagnosis because then that's just the study of dermatology and that would be a whole nother lecture. But it's really easy for us, once you've completed residency, to be able to tell. As long as you're seeing like a board certified dermatologist, they'll know. Autoimmune, things like that, even autoimmune conditions have rashes on certain locations of the body. So we'll be able to tell like, oh, this rash is here and there. Okay, we need to like order more labs or do a biopsy. All right. What advice would you give to someone that has acne? What do you think is the way to get rid of it? Okay, so if you have very mild acne, just like blackheads, little whiteheads, you can do over-the-counter products. But if you have deep acne, you're getting acne monthly with your cycles, you have deep cystic acne, honestly, you need oral medication or something systemic or to have a conversation with your dermatologist. So again, I'm not going to give recommendations on prescription medications, but for topical, you can use over-the-counter adapalene, which there's two companies that make that right now. One's called Differin Gel, and one is La Roche-Posay Effaclar. So you can start to use that nightly, use as directed, and that's probably the best thing that's over-the-counter right now to start with until you see a dermatologist. What's a good treatment for acne spots? Leave them alone. Don't treat them. Just keep them out of the sun. Don't pick them. Wear sunscreen when you're outside and treat your acne so you stop getting them because they will fade. What is one key go-to for a healthy and acne-free skin? For example, drink lots of water, proper moisturization, exfoliate regularly. Okay. Drinking lots of water, yes. Proper moisturization, yes. People think that if they moisturize their skin, it'll make it oilier. Not true. Especially when you're using acne medication, you'll get dry. I want you to moisturize your skin. Do not exfoliate. Not necessary, especially when you're treating your acne. And avoid having too much dairy products, especially milk that's sort of been messed with. Like whole milk is better than non-fat or low-fat. At least that's what the research shows. Don't come after me if you love your type of milk, but there's no study that alternative milks at the moment cause acne. So that's one way to go as well. What has been your most memorable case? I think I went into this, but I talked about some of the sadder concerning cases. My happiest cases, I don't even know if it's one, but I really get like excited when a patient with a chronic rash, a rash they've had for a really long time that other people said they couldn't treat, comes to me. I give them a very simple routine sometimes. I go, oh, it's just misdiagnosed. This is the diagnosis. This is what you do. And they're clear of their rashes. That to me makes me so happy. Outside of that, I also do see pediatrics. And so just having a few kids come through the clinic or babies, that also makes me really happy. It's just nice to see, useful patients coming in, especially if you could treat them and they feel comfortable, or people that have like kids that have warts on the fingers or face and they feel self-conscious, and you do something simple as treating warts and then they are excited to go back to school. Did you consider other specialties besides dermatology? You have to. Every year of medical school, every mentor will say, what if you don't get in? What if you don't get in? What are you going to do if you don't get in? You have to consider other specialties. I really was like, could I be a radiologist? I had done a year of general surgery, and I know that they wanted me to stay at the program, and I was like, can I be a general surgeon? Sure, I could have done any one of them. I kept telling myself, if I don't get in, I'll be a family medicine doctor that treats a lot of skin conditions. That was like my backup plan. But anyway, yeah, I made it. Do you treat warts? Yes. Yes. Okay, the best treatment is to come into the office and we spray it aggressively with liquid nitrogen. You have to get it repeated monthly if you really want to make it go away. One time won't do much. Now, if you're looking for over-the-counter treatment options, there's a product called Wart Stick. You just put it a little bit on your warts nightly and you cover it up with duct tape, like 3M duct tape. And you do that every night and it will help flatten your warts. But if your warts are thick, even that won't be sufficient. What is a good treatment for strawberry legs? My friend, what is strawberry legs? If anyone knows, put it in the chat room. I think what you're referring, now I know strawberry birthmarks, strawberries, those are hemangiomas, in which case you need to be on a certain oral medication that you have to get started with a pediatric dermatologist. I won't get into that. If you did want to get it treated, but I think you're referring to when the leg veins expand and contract, giving the legs like a webbed appearance sometimes. I think that's what you're talking about, and you don't need treatment for that. That's totally normal. Now, if I misunderstood you, that's different. So I'll look into that. Maybe I'll see what you meant later. What are some ways to treat or control keratosis pilaris? Keratosis pilaris is just an accentuation of the hair follicles on your upper arms. It's not anything bad. It's completely normal. It's that when your hair follicles are growing out, they're just snagging a little bit of skin with them, so you feel bumps. That's it. You can use creams that exfoliate the skin, not an exfoliating like cleanser. I mean like amlactin, A-M-L-A-C-T-I-N. It's a cream that can exfoliate the skin. You can buy it over the counter. You can apply it twice a day. It will make it go away while you're using it. If you stop using it, it comes back. So if your case is mild, it's just better to embrace it. A lot of people will get it really bad as teenagers, but then they'll grow out of it. How would you treat atopic dermatitis? Studies show that if you moisturize your skin every single day after coming out of the shower, whether you have eczema or not, that you will prevent recurrences and you'll have less chance of having itch or rash in the future. So the first step is to moisturize every day, make sure the products that touch your skin are all hypoallergenic and for sensitive skin. And then beyond that, you need to, if you're still getting outbreaks, you need to see a dermatologist and get medium or strong topical steroids. Unless you're a baby, mild topical steroids will not be sufficient for a flare-up. Okay, as a dermatologist, what do you like most about working in this field? I love the variety. I love that I treat rashes. I'm doing surgeries. I'm doing cosmetics. I'm doing nail surgery. I'm treating pediatrics. Most dermatologists are comfortable doing it like a wide range of things. I think I definitely am, and I've even taken it a step further. I came out of training really wanting to keep everything that I learned, and I really have so far. So that's what I love the most, that it's so variable. I don't know if anyone's ever had a job where you do the same monotonous thing every day. That can really weigh on you. It can sort of diminish your creative side or make you bored, and then you sort of resent work. So that's really exciting about my job. As a dermatologist, what do you like most about working in this field? I already answered that. Does your patients also view your skin based on your work? Like if you have acne, so they assume you may be a bad doctor. Guys, I think about that. So like dermatologists get acne. If we get bad flare-ups, we'll treat ourselves, but even when our skin is good, anybody's skin that's good and acne-free, you'll still get a zit here and there. You're never going to cure your acne. So as a dermatologist, if I get an outbreak, I can control it, but I can't control like having one zit a month. That's so random. In fact, I just had one pop up on my forehead this morning and I was like, oh my God, I'm having a YouTube talk. How could this happen? But then you tell yourself, stop, you're human, it's fine. Probably nobody's going to notice. So yeah, I wouldn't worry about it. Why did you pick a non-surgical path? Definitely not surgical. This is a surgical path. Remember, you can also be a Mohs surgeon where your entire practice is skin cancer removal and facial reconstruction. That's only 1 year after residency. You can even test into it. They're having a test this summer, and whoever passes the test can be a Mohs surgeon. It's exciting. And what are your thoughts on the cosmetic products? Do you recommend any of them? Yeah, I recommend a lot of them. I'll tell you, you do not need expensive cosmetic products. You guys, most of the things I recommend are at CVS. You can, moisturizers, I recommend Aveeno, Eucerin, Cetaphil, CeraVe, just a regular body cream or lotion. Most of the products that I recommend are not expensive. Now, if somebody wants something, they said, I want the best of the best of the best. Usually it's not even expensive, but if they want, for instance, the best vitamin C serum is made by SkinCeuticals. It's $160. They want the best vitamin C serum, I'll recommend that. But La Roche-Posay and CeraVe make an affordable vitamin C serum. So that's what I will recommend to most of my patients, unless they say they want the best of something. But usually the best is still the generic or the cheaper price, which is great. Guys, I did all the questions. Is there anything else? Did we find out what strawberry legs are? I'm gonna have to Google it.
Yeah, so I think you covered all the questions. Thank you so much. That was actually a really insightful presentation, and the questions definitely like cleared up a lot of things that a lot of people were wondering. So thank you so much for answering all those questions in the presentation. It was really great.
My pleasure. Yeah, thank you so much for having me. This was a lot more fun than I thought. Like I thought it was gonna be fun, but it was more fun. That's great.
I'm glad you enjoyed it as well. And like for everyone else who's still watching, just a reminder to finish doing the Google Forms and submit it as soon as possible to get your shadowing hour for today. But yeah, thank you so much.
All right, guys, you all have a wonderful day. Feel free to contact me or add me on Instagram and TikTok.